My name is Rihanna Sims. I'll be the clinician. Today we're doing the hip, thigh, and pelvis. The introduction is the hip is a deep ball and socket joint which allows for stability during weight-bearing exercises, as well as the ability to propel the athlete forward during performance. The purpose of this lab is to identify the anatomy of the hip, thigh, and pelvis, as well as special tests in order to understand abnormalities and rehabilitation involved in injury prevention. First, we're going to start off with strength with isometric abduction. It's to be done with the machine. It's in a seated position, and the athlete is to be resisted on the lateral side of the knee as the hip flexors fire to abduct or push away. This should be 3 sets of 10 to 12 reps. Okay, hold on. We're going to start out like this. Open, close, open, close. Now I'm going to bring my client in. We're going to lay on the ground on our side. Keep your feet together. We're going to open and then we're going to close. And that's 3 sets, 10 reps. Good job. Range of motion. We're going to do hip extension with the band. The athlete is to be standing, and the resistance band needs to be fixated on something stable, and the active leg needs to have the resistance band around it at the ankle. We're going to do 3 sets, 10 to 12 reps. So I have my resistance band down here, and I'm going to pull away. Then I'm going to show my client how to do this. So we're going to step on that side. We're going to put your foot inside the loop, and we're going to pull away. Great job. Balance. We're going to do hip flexion. Athlete, balance them on the left leg. We're going to raise the right leg straight out in front. Make sure the foot is flexed the entire time. We're going to alternate as well. We're going to do 3 sets, 10 to 15 reps. So we're going to stand on our left leg. We're going to put out, wrap it out, being flexed. We're going to hold 3 sets, 10 to 15 reps. Come on, let's try that. Stand on your left leg. We're going to hold. We're going to do 3 sets, 10 to 15 reps. Awesome. Flexibility. We're going to do the butterfly. The athlete is to be sitting and put the soles of the feet together. Use arms to apply some force, but it should not bring pain. We're going to do 3 sets, 20 seconds reps. So we're going to get on the floor. You're going to put your feet together. Apply pressure with your arms. All right, we're going to try that. We'll put our feet together. Use your arms to apply pressure. Should not bring pain. That's great. Core. We're going to do side planks. The athlete is on their side, propping themselves up on one elbow and forearm. Top arm is resting on top of leg. Lift pelvis. Keep the body aligned. We're going to do 3 sets with 20-second hold. So we're going to get on the ground, supported by your arm. Legs out. Prop yourself up. All right, we're going to try that together. Forearm down, feet together, lift yourself up. We're gonna hold. All right, that's awesome. Lastly, we're gonna do cardio with the stationary bike. And with this, we're gonna do it 30 to 60 minutes without resistance. Awesome.